There's 3:33. We'd like to open up the meeting now. I'd like to start with a little note. Please note that due to the COVID-19 coronavirus outbreak and due to Governor Baker's order, the town hall is closed to the public. Board of Health meetings will be live streamed via Zoom on the internet and via public access TV on Charter Spectrum Channel 191. In-person attendance and public comment at Board of Health meetings will be suspended until further notice. Prior to the meeting, the public may email a written public comment. It will be read at the Board of Health meeting. If correspondence is received after the meeting, it will be read at the next Board of Health meeting. Please send your public comments via email to healthdirector@townofsouthampton.eoh.org. And that is updated and posted on the town hall website, the correct email address to the Board of Health. I'd also like to say that just due to circumstances and throughout my week, I would like to have the vice chair hold this meeting. Charlie, if you would.
Okay. Well, good afternoon, everyone. Welcome to the Southampton Board of Health meeting of January 20th, 2021 at 3:30 p.m. Seeing I'm sort of conducting the meeting, I'm going to basically have individuals will be called by the chair to speak, and the chair will stay fast with the Board of Health agenda so that we don't wander off and get lost into all kinds of issues. So the first thing on our agenda, as the meeting is opened, is approving the minutes. Everyone's received a copy of the minutes. Has everyone had a time to review those? Any concerns? The only thing I did was I changed the last sentence of the minutes, and I believe you got an update on that relative to the, what do you call it, the executive session. So this is now corrected. I need a motion to approve the minutes. A thumbs up or an eye would help. All right, I see 2 ayes, so it's carried. Now, signature of the minutes. I would suggest that we just authorize the health director to sign them in our behalfs and just be done with it. All in favor?
Brooks, aye.
Oh, this could go real good if we could do it this way. Okay, all right. So the minutes are behind us. Now we're going to go into the health agent's report. Nicole?
Good afternoon. As far as my report, I'm still staying really busy with the Title V's and perk tests. It seems that since there's no snow cover, everybody's still working. Just today, I had 2 Title V's, 2 final inspections, and tomorrow I have a couple of perk tests lined right up. So I've been outside a lot this week taking care of those. And as soon as I wrap those up, I'm hoping it slows down a little to start again on restaurant and store inspections. For 2021, we sort of spaced them out last year due to COVID. I went out as I kind of could with regards to COVID. So I'm going to try to get as many as I can get done as fast as I can get done in the next month or 2, pending obviously COVID. So that's pretty much all I have at the moment. If anyone has any questions.
Nicole, are you using the new food inspection forms that came out last year?
I am, yes.
Okay. Just making sure if you didn't have them. Just making sure you have them, that's all. And as for
yep, I think they work out pretty good for the restaurants, but they're a little bit overkill for like the package stores and
grocery
some
stores.
Of the smaller.
Yeah.
I mean, the grocery store is okay, but the little package stores, it's a lot, but it's okay. We'll make it work.
I know. And realistically, as long as you fill in what you feel you need to address, that's all you need to do in my mind.
Yep. No, we used them for pretty much all the inspections in 2020 as well. So everyone knows that that's what they're getting now.
Okay. Any other questions from the board? Okay. Moving on to the health director's report.
Good afternoon. Actually, this office, as you can imagine, is really busy. Our Cottage Street issue is completed. Brickyard Road is in process. This week, our numbers have increased. We have 68 cases as of last Thursday, with more that have come in. And we expected this after the holidays. Folks were traveling, they were getting together. The transmission was not in the schools, it's folks and households getting together and not following the guidance. Hopefully the numbers will begin to go down. This morning, I had an email from the trial courts. They were looking for assistance in getting the trial court officers vaccinated, and they had not been specified as first responders. So I managed to connect with the Northampton clinic, and they will be able to go ahead and make their appointments and get their vaccine and be classified in the phase 1 group. Right now, I have constant calls. Everybody is very anxious about when they can get the vaccine. The Northampton vaccine site is going to continue through all 3 phases, as is the Amherst site. There's also a site at UMass, and that's technically called a mega site, but you have to be in that first phase and in order to get the vaccine. The Northampton site will be the rental site for Southampton. Individual towns are not going to be doing vaccine clinics, just simply due to the complexity of setting the clinic up, staffing it, the reporting and the billing system. The regional sites are really what the state has preferred. As soon as I get more information, and I'm hoping to get the messaging for all of this toward maybe the end of this week, if not the very beginning of next week, so we can get some information out. I know a lot of seniors were concerned because the registration for the clinics was going to be done online. Some didn't have computers. And that will be taken care of. There will be phone lines so that people can call in. Someone will enter their information, and then they'll get their appointment that way. I've had a lot of contact with the school nurses this last several weeks, actually. We have a very good relationship with the school nurses. I honestly have to admit they are wonderful to work with. I did get some information from Stephanie Foss, the nurse leader. She didn't have concerns as such. She just had some comments, and I have not had a chance to give it adequate attention, her questions, and I'd like to be able to take a look at what she sent me and be able to discuss it with her in a thoughtful manner. So I'll get back to her as soon as I can. We usually talk almost 7 days a week, and hopefully things will sort of settle down. And I know everybody would like to get kids back in school. We've supported the school nurses and their recommendations to the school committee. They're the ones that are in that school setting. They know their students and their staff, and we're in contact with them. I think that's about it for now. I have 13 callbacks on my answering machine right now. It's incredible. I can't keep up with it. And we're still running the Sharps program. So I have people who want to bring Sharps in and exchange, for a new container. And the real estate in Southampton is moving very quickly. I'm sure if anybody's checked the real estate pages online, I think there are bidding wars now on some of the houses. Nicole's been very busy with Title V inspections, realtors calling for, information about septic systems. It's a busy office. And I think that's about all I have for now, unless you have some questions.
Jerry, that vaccine center in Northampton, that's going to be the senior center?
Yes, it will be at the Bang Senior Center.
No, in Northampton.
Correct.
Okay.
I'm sorry. Yes, it will, not the Bangs. No, it will be at the Senior Center on Conn Street.
Okay, because the Bang Center's in Amherst.
I do know.
And
yes.
I don't think they're doing vaccine.
No, they're not.
Okay. Any other discussion or knowledge relative to vaccines, relative to, say, Westfield and Holyoke, seeing that they're the large cities near us?
I have not heard anything about Westfield or Holyoke at all. I don't know if they're doing something regionally or separately. I've
heard nothing.
I have not heard anything.
Okay.
I do know that sometimes the news gets a little ahead of us, and in today's news, it said that Walgreens and CVS would be opening up 15 sites for vaccine distribution for first responders. And there's a list. The only one here, I think, in Western Mass is in Pittsfield or Greenfield. I guess it's Greenfield. Most of them are in the eastern part of the state, but I don't know how soon they're going to roll a vaccine out to the pharmacies. All of this depends on how much vaccine the state gets first.
Yeah, and there's also going to be a change now that we have a new president and all that.
Administration.
I think we're going to see a lot of different rollout from the federal. Well, any questions of Jerry, board members?
I do not.
No questions.
Okay, then let's move on to Sharon Hart in contact tracing. Is Sharon on the line? I don't believe I'm saying this.
You might be on mute, right?
I think she is muted.
Oh, yes.
I think she's under John, so.
Yes.
Of course, everyone's got a different name here except me.
Hi.
Sharon,
Hello.
thank you for
Hi,
joining
Sharon.
us today.
Hi. So I was asked to come to talk about contact tracing and what's involved with contact tracing. So when a lab goes in, this may be information that you already know, but when the lab comes in with a positive test result, it goes into the state system, MAVEN, which is Massachusetts Virtual Epidemiological Network. And that network contains all the epidemiological, clinical, lab, and case investigation data. And so your information will go into that system, and it depends on what information goes in. So we typically get a copy of the lab result if it's positive. We do get your name, hopefully your telephone number, and your address.
Message is received from Laura Forbes.
Okay, so some of the challenges with this system is that we don't always get in the correct information. We may get somebody's address from when they lived in another, they may live in another location now. And when that happens, we then have to go into the system and transfer it to another town wherever they live. And sometimes we don't have the correct telephone information. So what the first attempt is to call them. If we can leave a message to call back. I've called up to 5 times.
New messages received from Laura Forbes.
Okay. And,
I'm shutting it off for you, Sharon.
okay. So then when we do make contact with the positive case, we go through all the information that we have on that person, their demographics, their address. Is it correct? Is their date of birth correct? And the town that they live in. Then we ask race, gender, if there's any disability. Then we ask if they're a healthcare worker, and there's questions if they are a healthcare worker. After that, we ask if there's symptoms. So what happens is if you have symptoms, your symptom onset date, you are actually contagious 2 days prior to that. So then we have to identify any of your contacts 2 days prior and up to the current time if you did come into contact with somebody. So then after we go through all the information, we have to go and take that information down and then contact those people. And again, that information is only as good as what we're given by the positive case. So we have gotten calls. We have called back and done the contact tracing with the positive case and the contacts that they gave us. But we have had families, thankfully, that have called either the Board of Health office or they've called the school to say, we're a contact too. So when we do ask if that person is a contact, the requirement for that is, have you been in contact with somebody within 6 feet distance for a period of 15 minutes or more? And that period is cumulative. So you may talk to somebody for 5 minutes at work, go off, they come back another 5 minutes. So it's cumulative over a 24-hour period. So we define that. So then we go on to the symptoms. They indicate, we go through this whole list of symptoms that they may have. And then we talk about, do they have any underlying health conditions? Have there been any clinical complications? Was the patient hospitalized? I've called people up and gone through all the symptoms, and then I get to the point where it's, have you been hospitalized for anything, any kind of x-ray? And I've had people say, yeah, I'm in the hospital right now. I'm interviewing in the hospital. And were they in the ICU? And then when we come back to closing out the case, we ask when the symptom resolution date was, what the outcome is, if we can get back to them. Sometimes people won't take the call back. They've gone through their period and may not take the call back. Right now, I'm going through those cases and following up with those. Some of the other questions we ask are exposures. What have their exposures been in the 14 days prior? Did they come into contact? Do they know of somebody who is a positive case? You know, do they feel they came into contact with somebody during travel? Did they travel out of state? Were they already identified for a quarantine? Let's see, other things, are they enrolled in a group, are they in a group setting? Did they have any, did they go to the hospital? Did they go to a nursing home? Were they in a jail? We have somebody who had been in a hospital, then went to rehab, back to a hospital. And so some of those are hard to, identify where the actual exposure was, but we do indicate them on their form. And then did they travel? So was there any travel? What does that look like? Was it a flight? We need the airlines, we need the flight data. Did they travel by car? When they went to the other state, were they tested? Did they feel like they had an exposure in another state? Let's see. Were they mask wearing? How long have they, do they mask wear outside of their household? How long do they maintain that social distance outside of their household? And then if it was a group setting, there's a whole set of questions about group settings, whether it's nursing home, rest homes, hospitals, daycares, schools, college, universities, boarding schools. And then they're asked about other related activities and settings that they may have. Did they go outside? Do they work outside their home? So we do ask them where they work, what their occupation is, where they work, their contact information at their work. So if we get somebody who works in a different town, we identify where they work, and then we transfer that information to that town. Some of the, then we identify the close contacts as best we can, given the information that we're given. We again go over their dates, how long, whether it's a quarantine or an isolation. So in isolation, starting on day 0 of your symptoms, you count 10 days out on the 11th day. If you haven't had a fever or your symptoms are better, you're released from isolation. It's a 10-day time-based. And prior to that, when this first started back in March, CDC and DPH were recommending 2 negative tests. Well, they no longer recommend that anymore. They've identified that you may still have particles that show up on the PCR, that nasal swab, that it's so sensitive, it may show up for months. So it's a 10-day time-based period. And what we do with that, if either their work or their school really wants to have them, needs some sort of measure to identify that they're out of their isolation or quarantine period, I will then look at those dates, identify those dates, and send them to Jerry, who has been absolutely busy writing letters for release of people to work, out of isolation or quarantine to school. So she's been bombarded with a lot of work with those letters and sending them out. And also what I try to do is get everybody's email. So there are the isolation and quarantine guidelines that we go over. We identify their timeframes. And then I send them both the isolation and quarantine guidelines. They may not identify somebody who's a contact, but I feel it's important still to go over those quarantine guidelines and send them to them so that they have them and they can review them. And so they get emailed those. If I don't hear from somebody, if they don't call me back, and I've called them several times, I will also send them by snail mail to their address. And I put on there my name, contact information, and ask them to call me as soon as they can. Some people have. I think we only got one, Jerry, we only got one back I put on the Southampton Board of Health return email, and I think we've only got one back. So there was a wrong address.
Months ago, right.
Yeah. So, again, we go over the information and go over the contacts. And then when we get the contact information and we call, we question the close contacts exposure. And then we input this all into the Maven system. So if we identify that somebody is not in our town, I will then put that address in and transfer it to that Board of Health town for them, where they're located, for them to follow up on. We just want to identify some of the issues that we've had in the past. We've had a couple different towns have group activities. I don't feel comfortable identifying what those group activities are, but the people who were in charge of those group activities had said to everybody at that location, you need to quarantine. Well, and then when I heard from the Board of Health, because we were getting comments, calls back, Jerry was, of possible exposures for everybody there, and why aren't they getting called? Well, what has to happen first is that business that has that business or activity, they have to first identify and talk with the Board of Health in their town. So they need to talk with the Board of Health, identify who is actually a contact. Not everybody in every class was a contact. So actually, on those larger cases, the state gets involved. And in these instances, they did. They got involved. They helped those towns identify who actually was the contact. They were required then to send out messaging, they were supposed to, that not everybody would be considered a contact. And so they had to put that messaging back out. And that if you're called by a contact tracer, please take that call. And that's important. It really is important. We work, so then when it came out, there was only a couple who were actually contacts and they were followed up on. There was a couple instances that happened with outside businesses. We work, and also it's important that if you feel that you are a contact and haven't been identified, the information isn't in the system. So we have to try and find that information. So if we don't have it and that person doesn't identify any of their contacts, it's important to contact the Board of Health. I know people have contacted the school and they forward that messaging to us and we've contacted them. And then we go through and identifying if they actually were. There have been cases where people thought they were, and when we look at the dates and the times, there was no exposure. So but it's important to stop the spread that we identify those people. So if anybody knows of anybody that hasn't been followed up, it's important that you contact the Board of Health and identify who that is, especially, just to stop the spread. I mean, otherwise we won't know. And even if you aren't, it's important to go through that. It's an educational process for both, and to identify where that exposure could have been. And again, it goes to 2 days before symptom onset. And so knowing when that symptom onset, you have to do the contact tracing to identify when those symptoms started, to identify when you were contagious. So it's a lot of moving parts, quite a few moving parts. And we've done, I think so far, probably over 500 cases, rough numbers. So I just wanted to give an update on, I think I've hopefully covered everything. And I think that's it. Charlie, you're.
Oh, Ed, I think Charlie needs to be unmuted, please.
Well.
Yeah,
Find him.
I don't know about that. Sharon, what would it like an average, how long would an average phone call take to make?
You're still muted.
No, I'm not muted. Now I think Sharon's muted.
Yeah, if you mute yourself, you're going to stay muted.
Okay. Sharon, I was just asking about how long would it take for an average phone call?
I don't know. I haven't timed them. Some people actually like to give you information. And so those calls may take a little bit longer. So I'd say, I can take calls up to an hour. But usually I'd say probably about a half an hour. I have gotten calls where I've asked to do the contact tracing and it's been difficult when you get things like, well, this is the stupid China virus and I've gotten some of those calls and I don't want to give you any information. I don't really know who you are. So then I try to get a little bit more in and say, well, this is who I am. This is what I have. I received this lab on such and such a date. And these are the questions I want to ask you. So I go through some of the questions and I say that I'm going to ask you what your symptoms were and when they started. And so that has gotten me far to identify to people who I am. I've also given them the Board of Health contact information that if they want to call there first before they take my call, that they can do that. But once I start talking about symptoms and what that might look like, I'd say most everybody. I think I had maybe one person actually two people who gave me their symptom information, but didn't want to give me any more, where they didn't want to give me where they worked. Luckily, I shouldn't say luckily, but the wife became positive and had a different number and then identified all the contacts. So in that way, that was helpful. Other than that, and then with the contacts, it may be more difficult with the contacts to connect with them. They don't always want to call back. They don't always want to be identified. So, but, we try the best and try to go through and call several times. And, after 5 times, I send it back to the state to say that we couldn't do follow-up. And then it goes to the state to see if they can do follow-up.
May I ask another question? So one question that's come up a few times is, are there challenges with the data that you're receiving from Maven? And, roughly what percentage of cases that you're receiving through Maven don't have correct or complete contact information?
In the beginning, it was a lot more. Now I'll get calls, I'll get numbers that aren't available, but I luckily have Jerry or I have the school system. So if it is associated with the school, they have contact information. Jerry, who knows the community, has been helpful, whether she gets online, looks for the any information. She's gone through and, she just has that community knowledge. And so we've been pretty successful. I couldn't give you, I'd have to go through all the cases. I actually couldn't tell you a percentage. It's not, I don't think it's a large percentage. I mean, considering all the contacts we do have.
Mm-hmm. Okay. And in terms of time frame, so another question that came up that I thought was a good question, and this would relate to safety with reopening the schools, is there a delay in the time where a case is identified as being positive and when that information is received in Maven?
Yes, it is. So some we had somebody say, well, my case is in there, I should be positive. Well, what happened was they had it done with their husband's business and it went to New Jersey. We've had cases come in 6 to 8 days later. We've had that, and that was more like right after Thanksgiving, those cases were coming in number, people were getting tested in numbers. And so we had a large delay, a long delay. And sometimes people would call Jerry's office or the school if they knew it and identify him. But we have, so we can take that data down and we can ask the state if it's in there and identify it. But there's no way that I can enter data into a system.
Right.
And identify. So what we have to do is have that contact. So to identify somebody's isolation or quarantine period, we need to know when that exposure was.
Right.
We need to know when their symptoms started. So even if we got the test date, we would still need to talk to them to identify. We could probably go by the test date and not their symptom onset, but right now I'm working on a case where we have somebody who was in a long-term care facility somewhere else, and they had a lab, and that lab was done with an address of a different town where they were staying. Well, when they got the test that they were positive, they had to come home. So they took a test again. I just got that data yesterday from the day before. So the turnaround now is much better. We get it within a day or two now, the labs. Well, so the concern now is that throws everybody off. So I only have the current lab that tested negative. So if that was on the 18th, I have to go by that date because the person is asymptomatic. They have no symptoms. So then I take that date, go out 10 days. Well, the person who's now, the people who are being quarantined because they're living in the house, that quarantine period does not end until the last exposure to that COVID positive. So you have to wait out the 10 days for that isolation period. Then the clock doesn't start ticking for those quarantines until their last exposure to a COVID positive. So on day 11, their quarantine now begins. So people can get really frustrated at the length of what these periods may mean, especially if they have to work. They need their so it is frustrating for people. It's frustrating to identify that, now it's another 10 days on top of that 10 days. And they do identify their frustration at times. And it's understandable, but we're trying to stop the spread, and that's the messaging. You just don't want this to continue. It's and it's hard because right now people are, they hear the same messaging, wear your mask when you're in public, but we have households that are it's just going through households. I can't tell you how much. It's just amazing to see. And it's hard for people to isolate and quarantine. And it's sad to hear some of these stories, about people not coming home, going to the hospital and not coming home. Those are difficult to hear.
Totally understandable. And I'm sorry if, one more question. So I know that the school has always been very concerned about not getting information that there are positive cases. And I know the school committee is meeting and that, they're going to have a representative speaking next. But in terms of chain of command of when the school is notified that there is a positive case, do you feel like you're able to reliably communicate that information, as it's received, that there are positive cases, or are there challenges with that?
I think there's challenges with it. We've had, I know that we've been working on our communication line. We've been talking just about every day, but it's difficult when the school calls, they're absolutely concerned about their community. Absolutely concerned, and just so. And sometimes they get that information before I would say most of the time, their community contacts them before we even get that information. So then, I have to kind of wait on that information. So there is a delay. There has been a delay before I can contact those people. Okay, if you're a contact, well, I have to find out who the positive is, identify when they may have come in contact with you before I can do your quarantine.
Mm-hmm.
So there's been difficulties with that. But I have to take what's in the system. I have called back people prior to that. It's not the best way to do it, but when they have the available information, the school does send it along.
Mm-hmm.
And actually, they usually follow up with a call. Also, they send an email and they have followed up with a call.
Okay, maybe we can hear a little bit more from John about, some of those challenges. So, given everything that's going on and the 68 cases that you're currently case tracing, another question that I've heard from a few people is, do you feel like you have enough resources to adequately provide contact tracing between you and Jerry for Southampton?
So right now, if we can't get to a case, the contact tracers, we have a certain period of time to go in and identify and take on that case. If we can't take on that case, then it goes to the contact tracers. So it doesn't sit in the queue.
So that's at the state level, correct?
That's at the state level. So the state level has hired contact tracers. What the contact tracers also follow up on is if we've had clusters in other towns. So if there's a group in another town that there's an outbreak and there are Southampton residents, the contact tracers may do that whole group, that whole cluster, and then they're identified to us afterwards. So we have knowledge of them because it's important that we get that information for locations. That information actually goes also to first responders. So no personal information goes to a first responder. What goes to the first responder, the police and the fire, are addresses. Okay. So that when they go to a situation, they're not walking in not knowing. And we've had a few of those. So it has been helpful.
And I've also heard that there's been some delays at the state level. So if a case goes to the state, I've heard that there's sometimes delays because they're also, I feel like once it leaves the Southampton town, we might have an even greater period of time where there's a delay. So how many of the cases do you feel have been referred? Do you know how many, what percentage or how many cases have been referred to the state level?
I think I actually was looking at my, so what I've gone through so far, there have been 15 that I know of. So that doesn't include those that they have done in clusters that happened outside of Southampton.
Oh, so like if it was at a skilled nursing facility out of, or a school or something, or a place
Out of another town, and they took it over. If it's a cluster, which is 2 or more, they may take it over, the contact tracers, and do all the contact tracing, and there's thousands of them.
Right.
So when it first started around Thanksgiving, where cases just went wild, they trained an additional 2,000 contact tracers. So if necessary, they can do it also. And then what they do is they report back and they identify what they've done.
Okay, and those people might not necessarily have the same depth of communication with the school committee or with other town committees because, you know, they're not personally invested or connected to our local community too.
Right.
Okay. Sorry, I feel like I've been asking a lot of questions. Thank you.
Okay, thank you. I actually have another, Charlie, are we good?
We're good. No other questions. Thank you, Sharon.
Thank you. And if anybody has any questions, and you want to give them to Jerry or Charlie or Becky, or is it Caitlin?
Yeah.
Please feel free to, and have them passed along.
Thank you, Sharon. I appreciate
Thank you.
all that information.
Bye-bye.
Thank you, Sharon. Moving forward on the agenda, our next part of this is the school committee representative. I don't know who's representing the school, but Ed, if you could unmute that person.
John's unmuted.
Afternoon.
Hey, John, I like your background.
It hides the mess.
Yeah, I got it. I got the Japanese folder in the back of me. Well, okay. A joint meeting between the Board of Health and the school committee is certainly doable, but you and me and Becky have to sort out how we're going to put this together. I guess my question to you before we get started is exactly what is the school committee looking for from the Board of Health?
Well, I guess the paraphrase, because I don't want to speak for the whole committee.
I understand that.
I'll just speak as the chair of the committee in broad terms, is going back to incidents that started to unfold in the first week of December that ultimately led to the closure of the school, and then additional communications or updates to the school committee led the school committee to request a joint session, because much like we wouldn't want the elected Board of Health to start questioning the superintendent, we didn't feel it was appropriate for the elected school committee to question the director of health who reports to the elected officials. And we're getting a lot of pushback, commentary, feedback from the public on answers that as a school committee, it's outside our purview. So in general, we felt the best approach would be a joint public session where the two elected bodies come together, can have a free for all, so to speak, discussion, air everything out, figure out roles and responsibilities in a public manner, and then kind of set the expectations. I believe that generated a one-page document that was shared with, as I understand it, was shared with you guys. Where it went, and if you've all seen it, I don't know, but it was authored by Stephanie Foss. And it's just kind of spelling out the roles and responsibilities of the two. So then if it needs to be tweaked, we can tweak it so everybody agrees to it. And then if we could, the school committee would then share that with the parents. This is what we understand is happening. If and when there's another issue, here are the steps. So just try to be more, school committee's looking to be as transparent as it can with the parents when we make our decisions, and that based on the information that's at hand.
Okay. Can you resend that document? so that it ends up on top of our pile instead of us trying to search it out?
Jerry forwarded it today or yesterday. It was just received very recently.
We're talking about the Stephanie letter? I thought there was something else here.
The Stephanie letter with the questions?
No, the title is the Southampton COVID-19 Case Management, the expectations, roles and responsibilities. It's a one-pager.
I think I saw that about a month or so ago.
I think it was January 7th.
So if that could be just resent, so it sends up. John, I sent you my cell phone number so that you can get hold of me directly. One of the issues we're having is Becky's working 12-hour days, and I support a lot of the public health communities in the area. So I'm out straight with stuff too, and Caitlin is also. So trying to get the three of us to coordinate a meeting with any great period of time is difficult.
I'm also assisting in COVID clinics. My hours are, I'm up to 90 or 100 hours every 2 weeks. So, and my free time, I just don't, I mean, I'm not saying that I'm the only one who doesn't have free time. We're all out straight right now, but I volunteered extra hours just to help out the communities surrounding us. So my time for a joint meeting like that, it took us, Caitlin, what, I think 3 weeks to get this day.
Yeah, a lot of back and forth emails, but we did. And you know, so I think it would be helpful to know what we're really trying to achieve through those meetings, you know, through that meeting, and figure out how to make it pretty concise so it answers everybody's questions.
And I agree with you. The question is more going to be when we can schedule this and what do you project is going to, how long it's going to take. But I think the first thing we need is that document to refresh ourselves.
Yeah.
And then go from there with that document.
Perhaps a middle ground may be, I can't do this till tomorrow night when the school committee meets, but perhaps your board can empower one of you to work with the chair of the school committee to kind of tweak this document ahead of time versus us trying to wordsmith it during the session.
Yeah, John, I like that. I like that a lot. That makes a lot of sense. Because trying to put, I don't know how many people we're talking about, but let's say we're going to put 12 people in the room. It's just difficult. Even when we do management stuff, we only try to have 5 people in a room at a time. Yeah, that's not bad. I guess my question is to the board members, would any of the board members like to take a jump at that? Or would you like to designate that to the director?
I mean, obviously we want to do what's best for the town of Southampton. If it would be helpful, I'm happy to take a stab at that with Stephanie.
You want to do the first brush? And then I'm more than happy to take and do the second brush, as they say?
Absolutely.
All right, so then let's do that. Do I hear a motion from the board to basically designate Kate to take and be the rep to start on this?
Let's make the motion. I'll second that.
Okay, all in favor? Done deal. Kate, you're gonna take the lead at this at the beginning, and do not hesitate to contact me.
Of course. Not that you ever have hesitated. You know, I also think that it's fair to acknowledge that the school committee has a really a big challenge in front of them, right? We know, regardless of contact tracing, regardless of all these other factors going on, that there is exponential growth curves across the state, and it's unpredictable. And unfortunately, the public, and it's not just in Southampton, is not necessarily 100% adhering to the recommendations from everybody for social distancing, avoiding gatherings. And I feel like, that's a big root of a lot of the family's frustration, is things that are not within the board's control. I do think that some more open communication would help to alleviate some of the concerns that are being brought forward from family members. But, I want to acknowledge that this is a really big challenge across the state. And in fact, I've talked to a couple different contact tracers from other communities who are experiencing all of the same challenges with lack of access to data and high volumes of information kind of coming into Maven at, case dumps happening all at the same time. And so, I do want to just acknowledge that I see that we're going to be able to improve communication, but I also want to just say that there's going to be some problems that we're going to face with this. And, I think it would be great to take them head on together, but I'm not sure that the board is going to be able to, solve every single one of these problems.
Well, I think you'll see part of your
Charlie?
documents.
Before I forget, can I interject something? As acting chair, I just want to remind you that under remote participation and remote meetings, that all votes have to be roll call votes. I didn't hear that on the last vote to have Caitlin work on the first cut of this. So you may want to take that motion and stack it up and do a roll call vote.
Okay, I have a motion to take and have Kate be the lead for this process. Becky?
I second that motion.
Caitlin?
I agree. Rooks, aye.
Okay, Charlie, aye.
Today, aye.
Okay.
Thank you.
Thank you, Ed, for keeping us in check.
Anything to make you feel good, Ed, that's not a problem.
Thank you.
Anyways. All right, John?
Yes.
So what are you thinking, a couple of weeks?
Yeah, I think if the two parties can work on this, Caitlin and Stephanie, and we get our regular updates from Stephanie. I think the key is to see forward momentum, right? I mean, trust me, nobody runs to the school committee to have 4 meetings a week in the middle of a pandemic. You think it's once a month, 9 months out of the year. So I completely understand everyone's level and everyone's working at 120%. But I think if we can show forward momentum, we want to get the kids back in school some way. And to the extent that we've been able to control the spread within the school, hats off to everybody involved. We just want to ensure it that way. And if there's an obstacle to overcome, if we can assist in overcoming it, then we want to be out in front of that and work collaboratively.
All right.
And the next school committee meeting is 7:30 tomorrow?
Tomorrow, yes. So the school committee meets every Friday at 5 o'clock and the sole topic is COVID. We review the state numbers that come out Thursday night. We have an internal dashboard that goes out on the district by lunch on Friday that pulls in all the communities. And then we look to go back. We're moving it up to Thursday night because we're closed at the moment with the intent of opening on Monday. But we need time. If we do open, we need time to buy the food for lunches, which is why we're meeting a day in advance.
Can you please send me that meeting information? And I'd love to listen in on that meeting, just so I can,
Sure.
that would be great.
So just to recap, you two will start working on that document, but you will copy all of us on the original document to bring it up on the top of our email list. And we will try to set up a joint meeting in a couple of weeks.
Yep. And I will try to listen in on some school committee meetings to hear, make sure that I have a good understanding about the problems that are happening.
And John, if you get desperate, you have my cell phone. Best thing with me is text.
Okay. Thank you very much.
All right. Anything else in front of the board? What about next year's budget? We should start thinking.
It's not on.
We should start
thinking about it.
Yeah, we should start thinking about the budget.
Yes, we should.
Given the fact that we were stripped money out of this year's budget and we're in the middle of a pandemic, we certainly realize that even if we get into next year, we're still going to be hopefully doing damage assessment and trying to bring things back to normal next year. At least that's my hope. Anything else,
Going to have,
anything else in front of the board? Then I would entertain a motion by roll call to adjourn.
Can I just ask one more question before we do that?
No, you've hit your limit.
So we also at some point, and if it can be the next meeting, but the CARES Act funding was extended through the rest of this year. And so I just didn't know if there were any needs that were identified that we might be able to take advantage of with use of the CARES fund.
We were denied. I know that Jerry did look at that paper, and I know that we got denied quite a few items that we did request.
What was the vaccine freezer?
Yeah, and when did it get
that's
extended
still
to?
denied.
When was the CARES Act extended to?
December
June
31st. Oh, no, I thought it was December.
December 31st, 2021.
Right. So I think, I thought at some point we were going to see what the pandemic was bringing, with minus the reasonable stuff that we've already purchased.
Well, I think that's something for discussion at the next meeting.
Yeah.
I just wanted to get people realizing we need to start talking about our budget. And I think the CARES Act should be part of that budget. I will still entertain a motion to adjourn unless you all just want to sit here.
Caitlin, you good?
Yes.
I make a motion to adjourn.
Caitlin?
I motion to adjourn.
I do also. Is that proper for you, Ed?
Well, I never heard a second, and then I didn't really hear the roll call, so.
Rook, second motion.
Dubay, aye.
Charlie, aye.
Rook's aye.
Perfect, thank you.
Thank you.
You
Thank
go.
you for helping with all this Zoom stuff, Ed. I appreciate it.
Well, right now, there's only 4 people watching us.
No.
Oh,
Thank you,
16,
Charlie,
excuse me.
again.
Good night, all.
Good night.
It was time at one point.
Bye.
See ya.
Bye.
Thank you. Thank you.